Let's discuss about basic cardiac rhythm decision tree. If there is the presence of P wave, then we have to see is that upright or not. If it is upright, then we should see there is more P than QRS. If there is more P than QRS, then we should see for PR constant. If PR constant is present, then there should be more than 2P in the row. If yes, then we consider it is first degree AB block. If there is absence of more than 2P, and we should check for the P dropped. If there is drop in P, we should consider 2:1 AB block. If there is no P dropped, then consider secondary AB block. If the PR constant is absent, then we should check if there is PR is progressively lengthening or not. If it is lengthening, then we consider it second degree type block. If it is absent, then we consider it complete hot block. If there is no more P than QRS, then we should see P wave morphology. If all P's are with same morphology, we should check the PR interval. If PR interval is more than 20, then it could be first degree hot block. If PR interval is not more than 20, we should check the rate. If rate is more than 100, then we call it sinus tachycardia. If rate is less than, not more than 100, then we should check rate. If it is less than 100, less than 60, then we consider it sinus bradycardia. If it is not less than 60, then we call it regular rhythm. If the rhythm is regular, we call it sinus rhythm. If regular is not rhythm, we call it sinus arrhythmia. Next, we should check if the P wave is not upright, then we should check the rate. If rate is between 40 to 60, then we call it junctional rhythm. If rate is not between the 14 to 60, then if it is from 60 to 100, then we call it accelerated junctional rhythm. If it is not between 16 to 100, then we call it junctional tachycardia. And for P of morphology, if P of morphology is not same and rate is less than 100, then we call it WAP. But if rate is not less than 100 and we have different P of morphology, then we call it multifocal atrial tachycardia. Now let's see for the absence of P wave. If the P wave is absent, then we should see there is sawtooth baseline or not. If there is sawtooth baseline, we call it atrial flutter. If there is no sawtooth baseline, then we check for QRS present or not. If QRS is present and the rhythm is regular, and if the QRS is narrow and heart rate is more than 150, then we call it SVT, supraventricular tachycardia. But if the heart rate is not less than 150, then we should check the rate. If it is between 40 to 60, we call it junctional rhythm. If it is not between 40 to 60, we again check the rate. If it is between 60 to 100, we call it accelerated junctional rhythm. If it is not, then we call it junctional tachycardia. And if the QRS is not narrow, then we check for the rate. If rate is between 40 to 50, we call it idioventricular rhythm. If it is not, we check the rate. If more than 100 to 110, we should check for the QRS. If QRS are the same, then monomorphic BT. If QR is different, it is polymorphic BT. But if the rate is not more than 100 to 110, then we call it accelerated idioventricular rhythm. Now, if there is the absence of QRS but presence of pseudo QRS, we call it ventricular fibrillations. If pseudo QRS is absent, we call it asystole. Regular rhythm, if it is absent, we call it atrial fibrillation, irregular. Thank you.